Welcome to the Radiology Review podcast, your on-the-go source for radiology education with your host, Dr. Matt Covington, a board-certified radiologist. Please follow the podcast on Twitter at RadRevPodcast. Send emails to theradiologyreview@gmail.com or visit the website theradiologyreview.com.
Let's talk about some of the named diseases in medicine that are really pertinent to radiology. What I'm talking about here are diseases that carry a specific name, such as Cheneys Syndrome, Cheneys Syndrome, Still's disease, and so forth. I admit some of these I don't know completely if I will pronounce them right, but I'll give it my best and spell them out where necessary, and please be patient if I say one of these in a way that's unusual to you. These named diseases are important for the core examination for a few reasons. The first of which is that these diseases span multiple organ systems. So it's possible you may get a question about one of these diseases in the cardiac section, and then you will also get a question on the same disease in the abdominal section or in the pediatric section or so forth. It's also easy to write test questions on these, and they tend to get asked with some frequency. I intend only to provide a brief overview and to bring these diseases to your mind so that in your board preparation, when you come across one of these named diseases, you stop and read it twice or 3 times, and remember this is something that's important for the core exam. I'm going to give you a few pieces of information for each of these that I feel are important to remember and may help with your board preparation. This is not a comprehensive review of each disease, but a quick overview of some of the things I think you should remember. Let's go ahead and get into it. The first I want to talk about is Hajdu-Cheney, and the pronunciation is unclear. It is spelled Hajdu-Cheney, Hajdu-Cheney Syndrome. And this is a rare connective tissue disorder. If you can only remember one thing with this disease, I personally think you should remember acroosteolysis. You will have short stature, which includes a short neck, and pseudoclubbing, which is shortening of the digits, and pain related to the acroosteolysis. That is not a complete review of this, but you can look it up in a book or online for further details. Next, I would remember Caisson Disease, that's Caisson disease. And this is the disease where you get nitrogen embolization if you surface too fast in scuba divers, or potentially a question STEM could ask you about something with aerospace or high altitude. And it's when the nitrogen comes out in bubbles and can cause problems. In terms of radiology, I would remember that this can cause hypoxia and potentially infarction in the spinal cord and brain, for which spinal cord lesions are actually more common than brain lesions. Also remember that this can cause bone infarction and osteonecrosis. The treatment for this is hyperbaric oxygen. Let's go on now to Riley-Day syndrome. This is a familial dysautonomia and causes neuropathic joints, also called Charcot joints or Charcot arthropathy. This is very rare, but if you can remember Riley-Day with Charcot joint and it's a congenital dysautonomia, I think you're on track. Let's go on to Behçet's disease, Behcets. This is associated with arthritis, congenital ulcers, iritis, meaning inflammation of the iris, and arteritis, inflammation of the vessels. So lots of itises with Behçet's disease: arthritis, iritis, arteritis, and also orogenital ulcers. From my experience, both on things like USMLE and radiology questions, they often will throw in the ulcers with some other things, and that may cue you into Behçet's disease. Still's disease, Stills. This is associated with lymphadenopathy, hepatosplenomegaly, and juvenile idiopathic arthritis. Note that your classic Still's disease is the early juvenile onset arthritis, and this is sometimes called juvenile rheumatoid arthritis, and it's one of the most common causes of arthritis in teenagers. It has a female predominance, and it typically starts early teenage years. A common way to test for this would be to show an x-ray that shows a lot of osteopenia, erosions, other signs of an inflammatory arthritis, as well as a cervical spine radiograph showing either erosion of the odontoid process, atlantoaxial subluxation, or other arthritis in the spine. Adult onset Still's disease may be worth mentioning because this is a distinct entity that presents with arthralgia, a characteristic rash, and high fevers. I think it's more likely you'll get questions on the juvenile idiopathic arthritis Still's disease on a radiology exam. Felty's disease, Feltys, is associated with rheumatoid arthritis, splenomegaly, and neutropenia. Now, several of these have really small differences, such as Still's and Felty's. Both have splenomegaly, both have arthritis. If you start to group these, it can be helpful. So for me, I group Still's and Felty's kind of in the same thing, and then if I can remember some of the differences about them. In this case, Felty's is more associated with neutropenia. Jacquot's arthropathy, that's GACCOUD, has classic ulnar deviation of the second to fifth fingers with metacarpophalangeal joint subluxation. That's a bit of an ant mini, so look it up. But that's the one thing I would remember. Jacquot arthropathy, if you only remember one, non-erosive ulnar deviation of the second to fifth fingers with subluxation of the MCP joints. Presence of erosions would make you lean more towards rheumatoid arthritis, so this is a non-erosive disease and has a strong association with systemic lupus erythematosus and occurs post-rheumatic fever. There's just too much here that's question writer's gold in terms of ease of writing a question with this, so spend some time and remember Jacquot's arthropathy. Lots of important associations that I mentioned here. For this, if they show you an image, I would suspect it will be a hand radiograph showing you the subluxations and lack of erosions. Let's move on to Morquio's disease, Morquiois. This is an autosomal recessive mucopolysaccharidosis. This would be one that might be a little less common to get questions on, but it's definitely fair game. This will present in much younger ages than many diseases, usually around 2 years of life, which is common with many of these mucopolysaccharidosis diseases. In this case, you end up with extremely short stature. You end up getting anterior vertebral body beaking, Platy spondoolie, atlantoaxial subluxation. So for this one, I would remember that it's a mucopolysaccharide deficiency and that you get lots of cervical spine problems. I would think it would be most likely they will show you a image of a cervical spine and you might see that Platy spondoolie or other issues in a very young person with a history suggestive of a genetic abnormality. And to clarify, Platy spondoolie, that's Platy spondyly, refers to flattening of the vertebral bodies pretty diffusely throughout the axial skeleton. There are several associations with that, including Gaucher's disease, Gaucher, that we'll get to next, as well as Morquio syndrome that I just discussed, and osteogenesis imperfecta, and thanatophoric dysplasia. There are a lot of these, and unfortunately, they're all fair game. But I'll do what I can to review some of them here, and then you can pay attention to these as you go forward with your board study. Let's go on to Gaucher's disease, Gaucher. This results in the accumulation of glycolipids. You have too little glucocerebroside, which is something within macrophages, and that causes increased ceramide in the reticuloendothelial system, which, as you can expect, will cause hepatosplenomegaly. This also has some hemochromatosis associated with it, and you have unhealthy bone marrow, which causes anemia, thrombocytopenia, leukopenia, bone pain. You can also have splenic infarct with this. You also can have osteoporosis with Erlenmeyer-Flass deformity, lytic bone lesions, aseptic necrosis of the femoral head. There's a lot of potential questions here. I do think this is one of the diseases that is worth spending time on because it's the most common lysosomal storage disorder, and there's a lot of great imaging that they can show for this. If you don't know what the Erlenmeyer-Flass deformity looks like, I would look that up. Also for this, remember the H-shaped vertebrae. If you don't remember what that looks like, look it up as well. To go a little further in detail, the Erlenmeyer-Flass deformity is a musculoskeletal finding on a femoral radiograph, typically, where you see constriction in the middle of the bone at the diaphysis, and then it flares as you get toward the metaphysis. Make sure and look this up so you know what it looks like. Associated with lysosomal storage diseases and other blood problems like sickle cell, thalassemia, things like that. This is a lot to take in, so let's call it there for now. I will continue the next episode covering more of these multisystemic diseases and describe some specific radiology findings that you can see across the spectrum of these diseases. Stay well, and I will catch you all next time. Content of this podcast is provided for informal educational purposes only for radiology trainees and radiologists. Medical practitioners, please make your own independent assessment before suggesting a diagnosis or recommending any course of treatment. This podcast should not be used for self-diagnosis or self-treatment and is not a substitute for independent professional medical care. Please consult your own physician regarding any diagnosis, imaging interpretation, or course of treatment.